ophthalmology, friends. Let me just introduce myself. Those who do not know, I am Dr. Shivani Jain from Delhi, and I did my MBBS from Government Medical College, Meerut, Maharashtra, MS from UCMS Delhi, and I am a private practitioner in Delhi, and have been teaching you students for last 8 years. And this is the book which I have written, the Focus Ophthalmology book, and it's very, very useful for your preparation for FMG. So it has a huge question bank, and you can revise the things very nicely with the book. If you have, you can have the access to the book, and if somebody wants that book, you can let me know also. Okay, so guys, before we start with ophthalmology, I really want to have a overview, how to want to give you an outlook or how we proceed for ophthalmology and how we are going to do in these 4 days, how the classes will be taken. Now, friends, nowadays ophthalmology is not a very small subject. I am sure you must be knowing that it is a subject which has, a lot of clinical based things. So nowadays it's not like you just cram up things. You read one book and you cram the questions without understanding, and you can get a good score. No, it's not a thing. So we all are preparing for December this year. We are preparing for the next examination. So you will have more of a clinical oriented exam, isn't it? A clinical orientation will be there. Now, last year also you have almost 23 questions from ophthalmology. Now it's not a very small subject, guys, isn't it? It's not a small subject. So you have to prepare nicely everything. Okay, you should have a basic knowledge of the subject. Now, like this year also, we expect a minimum of 15 to 18 questions, isn't it? So we'll start with ophthalmology now. And meanwhile, guys, you can write down your problem in the chat box, okay? But whatever things you are not able to understand, you can please write down to me in the chat box so that we have a good amount of discussion. It's not that I'm just teaching you and you're not able to make notes. So we will be writing everything. We'll make good notes so that you can revise ophthalmology very quickly with your notes. Okay. Chalo guys. So let me just see. So good time to start now, friends. Can we start? Can we start? Chalo. So this is the first diagram which everybody should know. This is your external eye. Guys, we know this is the eyebrow, this is the eyelash, that's your upper lid, the lower lid. Okay, we know that much. Now, you should know that this part where your upper lid and lower lid joins laterally, lateral, is your lateral canthus. Where it is joined medially, this place will be your medial canthus, isn't it? So let us draw where this medial and lateral canthus is. Okay, if this is the nose, this place should be your medial canthus, isn't it? Medial canthus. So I will like that if everybody make good diagrams, make good notes. ठीक है, सभी बच्चे अपने notes बनाएंगे अच्छे से, क्योंकि हमें ये notes ही revise करने हैं फिर. Okay, so we know this will be the lateral canthus, this will be the medial canthus. Now guys, when you see the medial canthus, you will find out that there is a pink color mass near this area. Okay, this pink color है ना यहाँ पे pink colored का. So this pink colored mass will be called as the caruncle. Okay, क्या कहते हैं इसको? We call it caruncle. Now besides this pink color mass, we also have a pinkish band nearby the caruncle. Okay, that's a small band here. Okay, this band, and this band is called as the plica semilunaris. ठीक है, क्या नाम दिया है? Plica semilunaris. Okay, now friends, the question here is, what is the importance of plica? So the word plica means a band. The word semilunaris means its shape, है ना? So this is a band which is semi-lunar in shape. That is why it is called as the plica semilunaris. Now, the question here is, what is the importance of plica? The importance of plica is that this is a vestigial structure. ठीक है? क्या question पूछते हैं? Which is the vestigial structure in eye? So the vestigial structure in eye is plica semilunaris. ठीक है? It's a very old question, you must know. I hope you know, guys, what is vestigial. Vestigial is that which has no role, like your appendix. So plica semilunaris is also a vestigial structure in the eye. It is like the nictitating membrane of the lower animals. ठीक है? Please याद रखना plica semilunaris. Now, guys, you see the white portion of the eye, the white area. So this white area is called as the sclera. क्या नाम दिया है? स्क्लेरा. सो स्क्लेरा के ऊपर भी एक ट्रांसपेरेंट लेयर है. देयर इज वन मोर ट्रांसपेरेंट लेयर ओवर द स्क्लेरा एंड वी कॉल इट द कॉन्जंक्टिवा. ठीक है. सो व्हाट इज स्क्लेरा? द वाइट पोर्शन. व्हाट इज कॉन्जंक्टिवा? The sclera is covered by a transparent layer and we call it conjunctiva. That is why I have written here sclera and conjunctiva both. हमने यहाँ दोनों लिख दिया, sclera and conjunctiva. Okay. Now let's talk about the colored portion of the eye. So guys, what is that colored portion of the eye? This part is called as the iris. ठीक है? इसको हमने क्या नाम दिया guys? Iris. What do you call it? The colored portion of the eye is called as the iris. Now you must be appreciating that this iris can be of different colors, isn't it? किसी में ये light brown है, किसी में black है, dark brown, even greenish, isn't it? You must be knowing the color of the eye of Aishwarya Rai, है ना? So she has a greenish color of the eye. Which part? The iris is green. ठीक है? Now it depends upon the number of melanin pigments you have in your iris. It is the melanin pigment which gives color to your iris. ठीक है? Is that okay? So you can have different colors of the iris, right friends? Please write down iris here. So iris has a central hole or the aperture, and you call this hole the aperture to be pupil. So please write down pupil here. ठीक है? The central hole, the aperture in the iris is called as the pupil. Okay friends, क्या नाम दिया है हमने? Pupil. Can you see me, Dr. Kavita? Dr. Kavita Nehra? Am I visible? The screen is visible. Please let me know if this is not okay. Okay now? Chalo, very good. Okay. Now, pupil क्या है? Pupil is not a structure, guys. Pupil is a hole. It's an aperture in the iris. Now, the question is, what is the size of the pupil? So, it is 2 to 4 mm. Okay, this is a question. Please write down Q wherever I am writing Q. That means this has been asked to you in some of your exams. Okay, so what is the normal size of pupil? 2 to 4 mm. Now, friends, please see very carefully. Over the iris and pupil, there is again a transparent layer. देख रहे हो आप? So this transparent anterior most structure of the eyeball, this whole thing is called as the cornea. Okay guys, इसको क्या नाम दे दिया हमने? Cornea. So iris and pupil are covered anteriorly by a transparent layer which is called as cornea. I hope this much is clear. ये सबको यहाँ तक सबको clear है? Is this external appearance of the eyeball clear? Any problem, please let me know. ठीक है? Now I'll explain you the same thing with the help of the diagram. ठीक है? अब हम इसको देखेंगे सब एक बार फिर से revise कर लेंगे quickly. Whatever we have read so far, we'll just quickly revise it. Okay? All of you please see this picture. That's just a quick revision here. ठीक है? देखिए सभी लोग बच्चे. We have seen that this part will be called as the medial canthus. It's medial. This will be called as the lateral canthus. It is lateral. So the white portion of the eye is your sclera. Over sclera we have the bulbar conjunctiva. ठीक है? We have the pink hair area here which is called as caruncle. This band shaped thing is called as the plica. This is the vestigial structure of the eye. The colored portion is called as the iris, isn't it? The colored portion is the iris. Iris has a central aperture which is called as the pupil. Pupil is 2 to 4 mm in size. Okay? Now we have seen that this part, the whole of this part is called as the cornea. Okay guys, so this one is your cornea. I hope यहाँ तक सबको clear है. This whole yellow thing is your cornea. Okay? Now, I want everybody should appreciate this. Now, I want to show you something. All of you please see. ठीक है? देखिए सभी लोग. So guys, can you appreciate this junction? The one which I have made in black. Can you appreciate this junction? This junction is actually a junction of cornea with the sclera, isn't it? यहाँ पे cornea है, यहाँ पे sclera है ना? So this is a junction of cornea with sclera ऑल्सो इट इज द जंक्शन ऑफ कॉर्निया विद कॉन्जंक्टिवा, क्योंकि कॉन्जंक्टिवा भी यहीं पर है. So this is a junction of cornea with conjunctiva. This is the junction of cornea with sclera, and this junction is called as the limbus. ठीक है? I hope now you agree. Where is limbus? So limbus is your corneoscleral junction. It is also your corneoconjunctival junction. You can please write down both of the things. Limbus, please just write down. Limbus is both corneoscleral junction and it is also a corneoconjunctival junction. Yes or no? Because both the things are together. Sclera and conjunctiva are overlying, isn't it? ठीक है, यहाँ तक clear है? Now guys, this is a very famous question about limbus. You should know what is the importance of limbus. So there are two things which one should know. The first is limbus has stem cells. ये बहुत बहुत important question है. Limbus has stem cells. Now you should know what is the importance of stem cells, है ना? Then only you will come to know why limbal stem cells are important. So guys, stem cells are also present in bone marrow. They have the power of self renewal. They can regenerate themselves, isn't it, on their own. They have the regenerative powers. So stem cells in the body can be utilized for treatment of various cancers, isn't it? Similarly, stem cells of the limbus can be utilized to cure many disorders of the eye. Okay, so they are very very important in dry eye patients. If you have a stem cell deficiency, you can have dry eye as a problem in the eye. Also you can have pterygium. Okay guys, so these questions can be there in your exam. EQ means expected question. EQ means expected question. ठीक है? If you can have a dry eye or pterygium when you have stem cell deficiency. ठीक है? Please remember these two disorders. ठीक है? Now, something more about stem cells. You should know what is the universal. What is the universal limbal stem cell marker? What is the universal limbal stem cell marker? Anybody from you? Anyone from your side? Any answer? Volume is not. See, I have no sort of disturbance here. I have even turned off the fan. Uh, Voice is still slow. Yes, Dr. Upshur, absolutely right. The universal limbal stem cell marker is ABCG2. Very good, very good. Okay, so this has been there in one of your exams. What is the universal limbal stem cell marker? ठीक है guys, आपने CD44 CD सुने हैं ना? CD है ना? CD markers. So those are not for limbus specifically. This is for limbus specifically. Please remember ABCG2. Okay. Chalo, good. So this is the first importance of limbus, that you have stem cells. Now exactly where stem cells are there, let us see. Where exactly the stem cells are present. So they are exactly present in the epithelium, in the epithelium of the limbus. Okay? Where in the limbus? In the corneal epithelium. ठीक है? Obviously they are in the cornea, so they are in the corneal epithelium at the limbus. Okay, please remember this much. Now friends, I'll be showing you a picture. Please see this picture. Please see this picture, all of you. Hanji. So again, this can be an expected question. This is the magnified limbus, the superior part of the limbus. It's a magnified limbus. And here, can you see something vertical striations? These vertical striations are your palisade of Vogt. So within these palisade of Vogt, this can be a question. Within these palisade of Vogt, your limbal stem cells are present. Okay? Again, I'm telling you, limbal stem cells are present at the limbus. Where exactly? In the epithelium of the cornea. Within the epithelium means within the palisade of Vogt they are present. Okay? So these three things you have to remember. Palisade of Vogt. Palisade of Vogt. Now, what is the second importance of limbus? What is the second importance of limbus? The second important thing about limbus is that whenever you want to make an incision for cataract surgery or for a glaucoma surgery, that entry into the interior segment will be with the help of limbus. Okay? Whenever you want to make an incision, guys, whenever you have to do a surgery like cataract surgery, you want to insert your instruments, isn't it? So that incision will be created at the level of limbus. Is it clear? Now have a look at this picture, you will come to know yourself. Please see, please see. Voice is not clear. Dr. Mohanty, there's no sort of instrument, any disturbance here. The internet is also doing good. um, okay, okay, I'm checking again. Okay. So friends, please see, please see, this is the limbal incision. Can you appreciate? This is your lens coming out. Can you see? So we have made the incision at the level of limbus. Okay, so these are two importance. First stem cells, second is limbal incision. Okay, chalo, let's talk about the next thing. Guys, have a look at this picture. This is not a picture question, but you have to have an idea about what is this condition. Please see. Can you all appreciate that this part of the iris has a light color and this part of the iris has a dark color? Can all of you appreciate this? I'm sure you can see, है ना? So this is one iris where iris is showing you different colors. Okay, so this particular condition is called as heterochromia iridis. Please all of you see heterochromia iridis. ठीक है, the word hetero का क्या मतलब है? Different. हेट्रो का क्या मतलब है? डिफरेंट. एंड क्रोम का क्या मतलब है? कलर. सो यू हैव डिफरेंट कलर्स ऑफ आइरिस इन वन आई. Okay, Dr. Mohammed Ibrahim, see, I would say that you are a little wrong, है ना? What your answer will be there for this question? Dr. Ibrahim, see, what you are answering is for Horner syndrome, and this is the patient who has Horner syndrome. So the first picture shows that the same iris has two colors. The other picture shows that two iris has different colors. Now you agree, Dr. Mohammed Ibrahim? Right iris has a light color and this iris has a normal color. Okay, so this is the next condition where your two iris have different color. This is called as heterochromia iridium. I hope now it is clear. So now they ask you a question that in which condition you see heterochromia iridium. Please write down, it is seen in patients of Horner syndrome. Okay. Again, heterochromia iridis means the same iris has two different color. Heterochromia iridium means the two iris has different colors. Okay? So this can be a picture question. They can ask you in which syndrome do you see such a picture of the iris. Okay? Please remember this is the question. So guys, this was the about the exteriors of the eye. Okay? This was the next. Now, what about the size of the pupil? So guys, we know the normal size of the pupil is 2 to 4 mm. Now, we should know all the conditions where the pupil has a small size and the conditions where pupil has a dilated size. Okay. Now, all of you, please see a very, very important thing to understand. Please see all of you. Iris has two different set of muscles. Okay. The first muscle is a circular muscle which is near the pupil. Okay, so this is your first muscle, the circular muscle which is near the pupil, the circular muscle. This muscle is called as the sphincter pupillae. What do you call it? This muscle is called as the sphincter pupillae. Okay? Sphincter pupillae. Now what about the second muscle? The second muscle has a radial arrangement. Okay, so this muscle has a radial arrangement. It is radially arranged and this muscle is called as the dilator pupillae. ठीक है, तो आइरिस में दो तरीके की मसल है. एक तो स्फिंक्टर मसल है. स्फिंक्टर मसल इज अ सर्कुलर मसल अरेंज्ड नियर द प्यूपिल. The second muscle is a radial muscle The name is dilator pupillae. Please remember first of all these two questions. Now, sphincter pupillae gets innervated by the third nerve. किससे इनर्वेट होती है? थर्ड नर्व से. व्हाट अबाउट डायलेटर प्यूपिली? डायलेटर प्यूपिली गेट्स इनर्वेटेड बाय द सिंपैथेटिक प्लेक्सस. सिंपैथेटिक प्लेक्सस का नाम सुना है? सिंपैथेटिक नर्व, सिंपैथेटिक प्लेक्सस. ओके, सो अगेन रिमेंबर द नर्व सप्लाई. Now, what happens when sphincter pupillae constricts? Common sense, guys, common sense देखिए. If this is your iris, this is the pupil central. If the central muscles are contracting, what will happen? What will happen? There will be a meiosis. There will be a constriction of the pupil. ठीक है ना? So when sphincter pupillae contracts, there will be meiosis. There will be meiosis, isn't it? There will be meiosis. Am I clear, friends? When sphincter pupillae contracts, there will be meiosis. Now, what about dilator pupillae? So, this is the radial muscle. When it contracts, what will happen to the pupil? The pupil will dilate. Okay? So, when dilator pupillae contracts, there will be mydriasis. Okay? Is that okay to all of you? Don't say that dilator pupillae will relax for mydriasis. No, dilator pupillae again has to contract. Okay? Very good, all of you. You know the fact. So these are three questions. Please remember, what are the two muscles? What are the locations? What is the nerve supply? Please remember. Okay? Now, guys, we will be reading all those conditions where you have meiosis and where you have mydriasis. So this is one chart which you have to write down first of all, and simultaneously you have to learn. And I'm sure by the end of these 4 days, you will be knowing, you will be learning all the conditions yourself by heart. Okay? So please write down all the things quickly. Meiosis means when you have a small pupil. So first of all, physiological conditions. जैसे अभी मैं बहुत लाइट वाले रूम में बैठी हूँ, है ना? सो लाइट वाले रूम में क्या होगा मेरे प्यूपिल को? माय प्यूपिल इज स्मॉल. ठीक है? और अगर आप अंधेरे में बैठे हो तो आपकी प्यूपिल डायलेटेड होगी. सिंपल. सो दीज आर फिजियोलॉजिकल कंडीशंस. व्हेन यू गो टू सनलाइट, व्हेन यू आर न्यूबॉर्न, एंड व्हेन यू ग्रो वेरी ओल्ड. जब हम पैदा होते हैं तब भी छोटे प्यूपिल, जब हम बूढ़े हो जाते हैं तब भी प्यूपिल छोटी. ओके, सो सेनिलिटी अगेन, योर प्यूपिल इज स्मॉल. Similarly, friends, a very, very important condition is when you accommodate. What do you mean by accommodation? What do you mean by accommodation, friends? Accommodation is when we are reading, when I'm reading. So today, now you are reading, your pupil must have been smaller. Is that clear? So these are some physiological conditions. Now what about mydriasis? Mydriasis when you are high on emotions. Okay? Kyun? Because you will have more sympathetic innervation. If you have more sympathetic innervation, obviously your pupil will dilate. More innervation to dilate a pupil. Okay? So first two lines are physiological, the next ones are pathological. Horner syndrome is one. We'll read Horner syndrome in detail. Opioids, okay? OP poisonings, organophosphorus poisonings, pilocarpine, uveitis, Argyll-Robertson pupil. So all these conditions are to be learned by heart. 2019, guys, you had a question from this topic, a small pupil and a dilated pupil. Okay? Now, opposite to pilocarpine is which drugs? ये कौन से drugs होते हैं? What are cycloplegic mydriatics, guys? Anyone? Cycloplegic mydriatics. Yes, atropine-like drugs. Very good, very good. Atropine, hometropine, cyclopentolate, है ना? All those drugs are cycloplegic mydriatics, by which your pupil will be dilated. Dr. Mohanty, what do you want to tell about the lens? You said something lens. आपका क्वेश्चन मैं समझी नहीं बेटा, प्लीज बताइए. Dr. Mohanty. All right, friends. So all these questions are to be learned by heart. Each and every word is a question here. ठीक है? We'll discuss the questions also. अच्छा. Okay, please don't be sorry. You आप बिल्कुल ठीक बता रहे हो. So accommodation is definitely related to your lens. It is definitely related to your ciliary muscles. Okay, very good, good. We'll be covering accommodation shortly. अभी हम accommodation के बारे में भी बात करेंगे. आप लिख लीजिए first of all. This chart is important. When you are done, do let me know. And those who are not writing, those who already have attended classes, or those people who already have some kind of notes, please learn within the class. ठीक है? अपना टाइम वेस्ट नहीं करना है, लर्न करो क्लास के अंदर, ऐसे करके लर्न करना है आपको क्या क्या कंडीशंस हैं. Wherever you have small pupil, wherever you have a large pupil, please learn. Clear this much? So guys, after that what we want to read is about the antero-posterior representation of the eye. We have seen what is outside. Now I would like to tell you what are the things which are in the antero-posterior representation of the eye. So we can say AP representation. This is going to be our next topic. AP representation of the eye. Friends, it's very simple. You can tell me yourself what should be this structure. Anterior most transparent structure of the eye. What should be this? Anterior most transparent structure. Very good, very good. This is the cornea. ठीक है ना? Anterior most transparent. This is how we represent the cornea. Very good. अब देखिए बच्चा. So what should be this? So what should be this? The white portion of the eye. What should be this? Very good. This should be your sclera. And you have the nerve which is going to the brain. ठीक है? This should be your optic nerve. Very good. बहुत ही गंदा diagram बनाया है मैंने. I am not familiar with this kind of actually. The workbook is little new for me. That is why I'm not making good diagrams. Pardon me for my handwriting also. I'm not very familiar with this wala notebook. Very sorry for that. So this is how we represent cornea and the sclera. ठीक है, बहुत बढ़िया. Now सभी लोग देखिए guys, what should be this? The colored portion of the eye. What should be this? So this colored portion of the eye is called as the iris, isn't it? This is your iris. That's how we draw iris. Now what should be this? The central aperture. This should be your pupil. And the central hole in the iris should be your pupil. Now what about this one, guys? What about this? The clear, transparent, lens. So this is your lens. Clear, transparent, biconvex is your lens. Now in the eyes, lens is suspended by. What should be this? ये क्या है? Lens is suspended in the eye with the help of zonules. What is the other name of zonules? You can also call them the ciliary zonules or the suspensory ligaments. What do you call them? You can also call them the suspensory ligaments. Very good. आपको तो बहुत कुछ आता है भाई. Very good. So you call them zonules or suspensory ligaments. Now guys, there's the one very favorite question of examiners. They ask you how many suspensory ligaments are there in each eye. So they are approximately 70 in each eye. ठीक है? They are approximately 70. ये 70 कैसे होती है देखिए बच्चे. When you see lens from the front, suppose you are standing in front of me, you see my dilated lens. Actually the suspensory ligaments are holding the lens everywhere 360 degree. है ना? Suspensory ligaments ऐसे होती हैं. They are holding the lens everywhere. But when you see this diagram, the top one, you will see the ligaments are only up and down. है ना? But actually they are 360 degrees surrounding the lens. Clear? So these are your 70 in number. Now, guys, what we have done? We have divided this eyeball into two segments. हमने क्या किया? इसको two segments में divide किया है. So anything which is in front of the lens and zonules, this one. So this whole thing will be called as the anterior segment. क्या बोला हमने इसको? We call it the anterior segment. And anything which is posterior to lens and zonules, we call it the posterior segment. I hope this much is clear. Now, as Dr. Vikrant has absolutely correctly told us, it is because of the humors. Anterior segment has a liquid which is called as the aqueous humor, and posterior segment has a liquid which is vitreous humor. ठीक है? These two humors are there in the defined compartments. They cannot be mixed unless until there is a breach. If there is a breach, they can get mixed and then बवाल मच जाएगा आंख में, है ना, दैट वी डू नॉट वांट. ओके, सो प्लीज रिमेंबर, anterior segment and posterior segment are divided because of the two different liquids in the eye. Okay, now anterior segment is further divided into two chambers. हमने क्या किया, इसको two chambers में divide कर दिया. One is called as the anterior chamber, another one is called as the posterior chamber. Now it is very simple to understand, guys. This is the space. Please see. So this is the space which is in between the cornea and iris. This is the space which is in between the cornea and the iris. So one which I am shading in blue is your anterior chamber. Okay? The one which is in the one which is in orange color. Can you see this orange color, guys? So this is your posterior chamber. So one very simple question came in your exam. They ask you which space is posterior chamber. So it is the space in between your iris and lens. Okay? All of you should know what is anterior chamber, what is the posterior chamber. Okay? Don't get confused within these segments. Segment बड़ा होता है, chamber छोटा होता है. ठीक है? Now, next question is about the volumes of each of them. Please remember, the volume of anterior chamber is 0.25 ml. Isn't it small? 0.25 ml. Now what about posterior chamber? It is very small, the smallest. It is only 0.06. Only 0.06. Now what about posterior segment? आप देख सकते हो posterior segment तो बड़ा है, बड़ा सारा है ना, बड़ा पीछे लेंस के सारा posterior segment. So it is a big one, 4 ml. The next volume is the volume of the eyeball. ठीक है? Volume of the eyeball. So what is the volume of eyeball as a whole? Eyeball का total volume है approximately 6.5 ml. Next is what is the volume of the orbit? So this has a volume of approximately 30 ml. ठीक है बच्चे? Very good, Dr. Imad, Dr. Sudeep, all of you are absolutely correct. Okay, so 5 volumes we have read. Chamber, anterior, chamber posterior, posterior segment, eyeball and the orbit. There are 5 volumes which we have to learn. Now what about the weight of the eyeball? Approximately again 7 grams. ठीक है, 7 ग्राम की आंख हो गई आपकी. Okay, चलिए. So guys, this was something about your antero-posterior representation. Now, I would like to tell you something about the codes of the eyeball. These are very basic things what we are reading. The codes of the eyeball. Codes of the eyeball. This is something very basic. ठीक है, इसमें से कोई question नहीं है, but हाँ, ये basic चीजें है ना? So the first coat is called as the fibrous coat. And the fibrous coat is made up of the cornea anterior and the sclera posterior. ठीक है ना? This is your fibrous coat. आगे क्या है? cornea, पीछे क्या है? sclera. Simple. This is the tough structure of the eyeball which prevents any kind of injury. है ना? It prevents anything to go inside the eye. ठीक है? This is your tough fibrous coat. Now the second coat of the eyeball is your vascular coat. That's why I'm making this in red. Vascular coat. So vascular coat has 3 things together. All of you first see and then we'll write down something. The first coat, the second coat is your vascular coat which begins with the iris. This is how we represent iris. Iris. Then is your ciliary body. The next part is your ciliary body. So this is your ciliary body. Have a look, everyone. This is your ciliary body. This whole thing is your ciliary body. Can you see? Ciliary body has 2 parts. All of you please appreciate. Ciliary body के 2 part होते हैं. The first part is having projections. That is why we call it the pars plicata. देख रहे हो आप लोग? पहला part क्या है? Projections जैसा है ना? Here also you have projections. Then you have the plain part. That is why we call it the pars plana. ठीक है ना? Pars plicata and pars plana. So these are 2 parts of the ciliary body. Now what about the posterior most part, the third part? The third part is called as the choroid. ठीक है, तो ये part क्या है अब? Choroid. This is all your choroid and this is the ciliary body. ठीक है, समझ में आ गया? And these 3 things together combined, iris, ciliary body, and choroid. These three things together are also called as the uveal tract. Three things together: iris, ciliary body, and choroid. They together combined is called as the uveal tract. याद रहेगा बच्चे, ठीक है? Now, coming to the third part of the third coat of the eyeball, we call it the neural layer. The neural layer, ठीक है? This is the neural layer or the innermost layer, and this is represented by retina. ठीक है? अब क्या है यहाँ पे retina? How I'm going to draw retina? This is your retina, guys. This one. Okay. Now we have the lens here. So guys, can you appreciate something special about the neural layer? This neural layer is not the complete coat of the eyeball, isn't it? It's only in the posterior segment. Can you make it out? ये लेंस के आगे तो नहीं जा रहा है. It's not a complete layer. So this neural layer is a, first of all, it's an incomplete layer. It is represented. स्क्रीन बड़ी करने का ऑप्शन नहीं आ रहा है मुझे, कैसे करने का है? I don't think we have option here. Yeah, I think screen body.
कौन सी स्क्रीन बड़ी?
They're asking if I can increase the size of the screen. यहाँ तो हो गया.
एक मिनट चल रहा.
They want the full size of the screen.
नहीं होगी.
है ना? नहीं होता. अभी पॉज है क्या हमारा? ये तो लाइन छोड़ दो. Yeah, I'll do it after we finish this topic because I've already magnified this ना. ठीक है? मैं अभी इसको बड़ा करती हूँ. नेक्स्ट टॉपिक से शुरू करते हैं. ठीक है? Thank you. Even I wanted the bigger screen. Okay. So this neural layer, guys, if you can see, it's an incomplete layer. It's not going into the anterior segment, isn't it, friends? Now you must remember that neural layer, first of all, it is represented by retina. It is represented by retina. ठीक है? अब देखिए इसमें क्वेश्चन क्या पूछते हैं बच्चे? What is the question here? They ask you which point is this? Can you see this point? So this point is the anterior most part of the retina. It is called as the ora serrata. भैया, it is called as the ora serrata. आपके फैन के लिए नहीं, वहां से स्विच ऑन कीजिए. नीचे स्विच है, सारे कर दो. ora serrata. ठीक है फ्रेंड्स? So this part, the anterior most part of the retina is called as the ora serrata. Okay. Now, what is the next question? So the next question they ask you is, what is special about the ora? So first is, this is the anterior most part of the retina. The second part about ora serrata is that this is also the thinnest portion of the retina. Okay? Please remember, this is also the thinnest part of the retina. So ora serrata, two important things. First, it is the anterior most part of the retina. Second is, this is also the thinnest part of the retina. ठीक है? Please remember, friends. This is the thinnest part of the retina. Now, is it okay? This ये landscape ही था. Now it is okay. चलो, good, good, good. Even I am happy with this size. चलो, good. बच्चे आप इधर देखिए, वापस हम इसी डायग्राम पे आ रहे हैं. Let's come back to the diagram. Now, guys, this is your vitreous. Now you know the layers, the sclera, the choroid, the retina, and the vitreous. You know the layers now, है ना? You know what are the contents now. Just think about something. Suppose when I want to do a vitreous surgery, suppose I want to do a vitreous or a retina surgery, suppose, do you think I'll enter from the limbus? आपको limbus याद है ना? Limbus याद है आपको? So do you think I'll enter from the limbus and damage the lens and go inside? No, never, never. When I want to do a surgery in the vitreous cavity, I'll never enter from the limbus. Rather, I will enter from a safe place and this safe place is behind the limbus. This is called as the approach through pars plana. ठीक है, हमने ये pars plana पढ़ा है ना, this is pars plana. So whenever we want to do a surgery into the vitreous cavity, we always go behind the limbus through pars plana. So I'll be showing you a diagram. Please all of you see, all of you please see. This is the vitreous, yes or no? This is my vitreous cavity, है ना? So when I want to enter within the limbus, within the vitreous, I never make an incision at the limbus, never, because that way I will be damaging my lens. तो मैं कहाँ से जाऊँ? मैं pars plana से जाऊँगी. इसका नाम इन्होंने क्या रखा है? The pars plana route. It's a safer area where I am not going to damage the lens. ठीक है? Guys, this is a picture question. They'll give you the picture and ask you कि ये कौन सी अप्रोच है, विच टाइप ऑफ इंजेक्शन इज दिस. दिस इंजेक्शन इज द डायरेक्ट इंट्राविट्रियल इंजेक्शन. दैट मीन्स आई एम गिविंग द इंजेक्शन राइट देयर इनटू माय विट्रियस कैविटी. ठीक है, समझ में आ रहा है सबको? ये लिम्बस से नहीं दे रहे, हम आंख के अंदर दे रहे हैं, पर हम विट्रियस कैविटी में डायरेक्ट इंजेक्शन दे रहे हैं. ऑल ऑफ यू क्लियर? एंड फ्रॉम विच अप्रोच? दिस इज द पार्स प्लाना अप्रोच. ठीक है, डॉक्टर ऋषभ, मैं कह रही हूँ कि थिनेस्ट पार्ट ऑफ रेटिना इज योर ओरा सिराटा. This is not only the interior most part of the retina, but this is also the thinnest part of the retina. Okay, Dr. Rishabh, is it clear to you? ठीक है? Any other doubts, guys? Any other problem? यहाँ तक सबको समझ में आ रहा है? Can you identify this picture question? They'll give you the picture. ये पिक्चर आपको दे देंगे, पूछेंगे कौन सा इंजेक्शन है ये, कौन सी अप्रोच है ये. दिस इज द अप्रोच थ्रू पार्स प्लाना एंड दिस इंजेक्शन इज द इंट्राविट्रियल इंजेक्शन. ठीक है बच्चे, यहाँ तक क्लियर है ना? नाउ इज इट ओके? चलो, गुड गुड. नाउ लेट्स कम बैक टू आवर सीलियरी बॉडी, है ना? सीलियरी बॉडी पे फिर से आते हैं. सो फ्रेंड्स, ciliary body has pars plana and ciliary body also has the pars plicata. So what about pars plicata? इसका क्या काम है? यहाँ से क्या secretion होता है? What gets secreted through pars plicata? हाँ जी, ये मैं लिख नहीं रही हूँ, आप बताओ. हाँ, डॉक्टर कौर, यू आर एब्सोल्युटली राइट. सो योर एक्वस ह्यूमर इज सीक्रेटेड फ्रॉम पार्स प्लाइकेटा. ठीक है, नाउ वी नो बोथ द थिंग्स. We know a special thing about pars plana. We know what is pars plicata. So aqueous humor gets secreted from the pars plicata. Very good. Now understand this, guys. Your ciliary body has two parts, and the main content of your ciliary body is the ciliary muscles. Now what is the role of ciliary muscles? अभी हमने क्या पढ़ा? We have read about the muscles of the iris. Yes or no? We have read iris muscles, two muscles, the sphincter pupillae, the dilator pupillae. Now we are going to read something about the ciliary muscles and something about the accommodation. ठीक है, जो अभी पहले डॉक्टर ने बताया था ना, ciliary muscles and accommodation. We are now reading in detail about this topic, ciliary muscles and accommodation. Okay. So everybody look at me to understand. Suppose I'm looking at a distant gaze, मैं दूर देख रही हूँ, तो मेरी आंख में जो स्ट्रक्चर्स है वो अलग मूड में है ना? They are in a different mood. Different mood. Now when I'm reading, my structures of the eye behave differently. So there are certain changes which happen in the eye during accommodation. What is accommodation? The power of my eyeball by which I can see clearly for near. मेरे को पास का देखना है तो मेरी आई में क्या हो रहा है? अकोमोडेशन हो रहा है. ठीक है, सो देयर आर सर्टेन चेंजेस. लेट अस अंडरस्टैंड देम वन बाय वन. ठीक है, सो दिस इज अ नॉर्मल स्टेज ऑफ द आई व्हेन आई एम लुकिंग एट द डिस्टेंस. व्हाट इज हैपनिंग? मेरा लेंस जो है वो थोड़ा सा फ्लैट है. माय लेंस इज लिटिल फ्लैटर. माय zonules are stretched. My zonules are taut. They are stretched. They are keeping my lens flatter. ठीक है. Now what will happen when I start accommodating, when I am looking at the near? What will be the change? The first change is that my ciliary muscles, the ciliary muscles will start contracting. When the muscles get contract, what will happen to the zonules? Zonules which were taut, now they are relaxed. ठीक है, तो zonules को क्या हो जाएगा? They will get relaxed. Relaxed. What will happen to the lens? Lens will become more convex. Can you see the change? So please write down what are the changes during accommodation. First of all, which muscles are contracted? The ciliary muscles are contracting. Okay? They contract. So what will happen to the zonules? As you all are correctly telling me, zonules are relaxed. What happens to the lens? Lens becomes more convex. ठीक है ना? लेंस पहले भी कॉन्वेक्स था, बट अब क्या हो गया है? अब वो ज्यादा कॉन्वेक्स हो गया है ना? लेंस पहले ऐसे था बेटा, देखिए ऐसे, and now lens is like that. ठीक है? So now here comes a very important question. They ask you which surface of the lens becomes more convex. So can you answer me? Which surface of the lens? Yes. Very good, Dr. Imad. Anterior surface, which was like that, it becomes like this. ठीक है? The posterior surface, वो पहले से ही है, देखिए ऐसा होता है normally. ठीक है? जब मैं दूर देख रही हूँ तो ऐसा होगा, जब मैं पास देख रही हूँ तो इंटीरियर विल बिकम मोर कॉन्वेक्स. ओके, सो दिस कैन बी अगेन अ वेरी इंपॉर्टेंट क्वेश्चन. इट इज मेनली द एंटीरियर which becomes more curved. Okay, please remember this can be. Yes, so whatever we are writing, Dr. Vagela, these all are the changes in the eye during accommodation. ठीक है? आप पढ़ रहे हो, आपकी आंख में भी अभी हो रहा है, आपके सीलियरी मसल्स कॉन्ट्रैक्ट हो गए हैं, जोन्यूल्स रिलैक्स हो गए हैं, लेंस कॉन्वेक्स हो गया है और ज्यादा. ठीक है? और क्या हुआ है? व्हाट आर द अदर चेंजेस गाइस? व्हाट आर द अदर चेंजेस? आपने पहले पढ़ा है, another change is meiosis. Your pupil will become smaller, isn't it? Your pupil will become smaller. Now what about the accommodation? What about the accommodation? What about the convergence? The convergence is also there with accommodation. Convergence क्या होता है? जब आप पढ़ते हो तो आपकी आंख अंदर नहीं चली जाती, अंदर, है ना? This is a little inward deviation of the eye like that. This is called as convergence. ठीक है? When I'm looking at a distance, my eyes appear parallel, but when I'm reading, my eyes are lightly converged. Okay? So this happens with everyone. Please remember all these changes are very important. ठीक है, ये समझ में आया? नाउ अ वेरी इंपॉर्टेंट एक्सपेक्टेड क्वेश्चन. व्हाट इज द क्लासिकल ट्राइड फॉर अकोमोडेशन? व्हाट इज द क्लासिकल ट्राइड फॉर अकोमोडेशन? कौन बताएगा? व्हाट इज द क्लासिकल ट्राइड फॉर अकोमोडेशन? हाँ जी, एनीवन? वेरी नाइस, वेरी गुड डॉक्टर इमाद, बहुत बढ़िया. So he says that there are three things for accommodation, and you can remember these three with the help of the short form camera. Camera, what is that? This is a classical triad of convergence, accommodation, and meiosis. ठीक है? Meiosis. These are the three things which happen when you are looking at mirror and when you are accommodating. Is that clear? Dr. Yogita, you are saying something else. You probably want to say that these things are helping us in accommodation, है ना? But these, the three things which Dr. Imad has said, this is a classical triad for accommodation. Accommodation पे बहुत सारे questions आते हैं. They can ask you which is not seen in accommodation or which is correct about accommodation. Please remember all of them. ठीक है बच्चे? यहाँ तक सबको क्लियर होता है? Anyone, any doubt? Chalo, good. Let's talk about now something in the development of the eyeball. ठीक है? Development of the eyeball. So guys, this is a little controversial topic, and I would say that since many years they are not asking you any question. So we'll just briefly read about the development of eye. ठीक है? First of all, you should know at what time period the development starts. So it starts at around third week of gestation. ठीक है? It starts at around the third week of gestation. Now, there is a gene which all of you should know is the PAC6 gene. इस gene का क्या काम है बच्चे? This gene is the gene for eyeball morphogenesis. Morphogenesis समझते हो? Morpho. Morpho means morphology, genesis means development. So this is the master gene for the development of the eyeball. Okay? This is the master gene. Suppose a mutation happens in this gene, so what will happen? अगर इस जीन में ही म्यूटेशन हो जाए तो क्या होएगा बच्चे? आई बॉल बनेगी ही नहीं, है ना? आई बॉल will not be properly formed, it will be malformed. So this gene is very important. It is called as the master gene for development of eyeball. Am I clear? पैक 16 ये ठीक है. अब आप मुझे germ layer के नाम बता दो. What are the names of the germ layer, guys? We have a endoderm, we have a mesoderm, and we have a ectoderm. Yes or no? है ना? Endo, exo, meso, है ना? Ecto, meso. So first thing which we have to remember is that there is no role of endoderm. एंडोडर्म का कोई रोल नहीं है आई बॉल की डेवलपमेंट में. वी हैव एक्टोडर्म, वी हैव मेसोडर्म. ठीक है, फर्स्ट एंडोडर्म इज आउट. नाउ एक्टोडर्म वी हैव डिवाइडेड इनटू टू. व्हाट? द फर्स्ट इज द सरफेस एक्टोडर्म, द नेक्स्ट वन इज द न्यूरो एक्टोडर्म. ठीक है, हमने क्या किया? सरफेस एक्टोडर्म और न्यूरो एक्टोडर्म में दो में डिवाइड कर दिया. ठीक है. Now, all of you please see very carefully, very carefully. What do you understand by the word surface? Surface मतलब बाहर. ये मेरा surface है ना? Surface है तो वो चीजें जो बाहर है वो बनती है surface ectoderm से. जैसे कि leg. Leg is the mnemonic here. It's not the leg of the body, but the mnemonic is leg. So L से क्या बना? Lids. L से क्या बना? Lens. Okay, lid and lens both. Okay, Dr. Sudeep. What about E? E से क्या है? Epithelium. But epithelium of what? Epithelium of cornea and epithelium of conjunctiva both. Epithelium of cornea and the epithelium of conjunctiva both. This is clear? This is your E. Now what about G? G से है glands. You know there are so many glands in the eye, meibomian gland, Moll gland, Zeiss gland. So all of them are developed by your surface ectoderm. Easy to remember? याद रहेगा बच्चे सबको? Easy है ना? Now what about neuroectoderm? So neuro, the word neuro suggests the neural tube, neuro. So neural tube से सबसे पहले तो क्या आ रहा होगा brain? Optic nerve, simple, optic nerve है ना? So the mnemonic here is Boyer. What is Boyer? The mnemonic for the structures which are derived by neuroectoderm. Very easy to remember. Vitreous, vitreous. The next one is O. O से क्या बनेगा बेटा? Optic nerve. O से optic nerve. What about I? Iris and its muscles. And R is your retina. Okay? So these are the structures which are derived by neuroectoderm, the neural layer. Okay, neuroectoderm or the neural layer. ये clear है? So Boyer is the mnemonic, vitreous, optic nerve, iris and its muscles, and retina. Okay? So what is remaining? Mesoderm. अब mesoderm से क्या बनेगा देखते हैं बच्चे. So if I say the word mesoderm, what is the first thing which strikes your mind? आपके दिमाग में mesoderm से क्या बात आती है? mesoderm से क्या बनना चाहिए बताइए? mesoderm से बननी चाहिए muscles. So which muscles? The extraocular muscles. Very good. The extraocular muscles. Am I clear, friends? mesoderm से बननी चाहिए muscles. तो कौन सी muscles? The extraocular muscles. Superior rectus, inferior rectus नाम सुना है ना हमने? So वही वाले muscles. What else? Some part of sclera also. Some part of sclera also. ठीक है? Now here comes the most important derivative, most important question, the neural crest cells. हाँ जी बच्चे, आपकी anatomy हो गई है? Your anatomy is done. So if you have done anatomy, you must be knowing that neural crest cells are some specialized cells, isn't it? What is the special thing? What is the special thing about neural crest cells? They have the pluripotent potential. है ना? They can develop into anything. So these cells are some specialized cells. They tickle off from the ectoderm only, and then they migrate, invade into various spaces. ठीक है, ये न्यूरल क्रेस्ट सेल्स कुछ स्पेशल सेल्स होते हैं. ओके, now here neural crest cells gives very important things in eye, and to learn them we have a mnemonic CST. CST को आप या तो continue the same treatment कह लो, या आप इसको कैवर्नस साइनस थ्रोम्बोसिस कह लो, बट यू हैव टू लर्न. ठीक है, CST, दिस इज द डेरिवेटिव. नाउ व्हाट इज C? फर्स्ट इज द सीलियरी मसल्स. द सेकेंड वेरी वेरी इंपॉर्टेंट इज द कॉर्निया. बट आप बोलोगे मैम कॉर्निया तो यहाँ भी है और कॉर्निया यहाँ भी था. So please see all of you, this is your tricky question. Very good, Dr. Prashant. The corneal epithelium is developed by surface ectoderm, but all the inner layers of the cornea are developed by the neural crest cells. ठीक है, this is one tricky question, a very important question. The inner layers of cornea. Am I clear? Am I clear, friends? The inner layers of the cornea. ठीक है. Now what about another C? Next C is ciliary ganglion. The next C is ciliary ganglion. What about S? Some part of sclera. Some part of sclera is produced by neural crest cells. Some part. Next is Schwann cells. What about T? T is important. T is trabecular meshwork. Trabecular meshwork. ट्रैबिक्यूलर मेशवर्क हम ग्लोकोमा में पढ़ेंगे. ठीक है, कल पढ़ेंगे. ट्रैबिक्यूलर मेशवर्क is developed by neural crest cells. So these are the derivatives, guys. A very very important question, please remember. ठीक है. Now I am going to ask you something. You have everything in front of you, all the mnemonics, all the derivatives. So you have to tell me the first quick answer. ठीक है, quick answers आप मुझे बताना. बताओ. Corneal epithelium is derived by epithelium of the cornea. Yes. Surface ectoderm है ना. Surface ectoderm. So what about endoderm of the cornea? Endoderm. Endoderm of the cornea. Endoderm is your innermost layer. So it will be developed by NCC. Very good. ये समझ में आया? Very good. Now listen to me again. Superior rectus muscle is derived by mesoderm. Ciliary muscles, you saw here, the ciliary muscles are derived by the neural crest cells. Yes or no? Ciliary muscles. Ciliary muscles, है ना? But what about the muscles of iris? Iris muscles like sphincter pupillae, dilator pupillae, don't say that they are derived by mesoderm. Actually, the muscles of the iris are derived by the neural crest cells. ठीक है? Sorry, the neuroectoderm. Yes, Dr. Kajal, you are absolutely right. ठीक है? And Dr. Sogenis. बेटा एक्टोडर्म जब भी आप बोलते हो तो पूरा एक्टोडर्म बताओ. ठीक है? डॉक्टर सोजेनिस. आप जब भी आप यू से एक्टोडर्म, प्लीज से स्पेसिफाई इट इज अ सरफेस और न्यूरो एक्टोडर्म. ओके बेटा, एवरी टाइम मेक अ हैबिट ऑफ स्पेसिफाइंग द थिंग्स, है ना. एक्टोडर्म तो बिल्कुल ब्रॉड टर्म हो गया. Okay, so again I am repeating, there are three sets of muscles: extraocular muscles, mesoderm; ciliary muscles, neural crest cells; sphincter pupillae and dilator pupillae, the muscles of the iris, are neuroectoderm. So three different set of muscles, three different derivatives. ये सबको clear है? So this was a little easy part. Now let's talk something little tricky. ठीक है, सभी लोग पहले डायग्राम समझेंगे. It's very simple but it is little tricky. ठीक है, देखिए ऐसे. So when your eyeball is developing, it's like a neuroectoderm cup which is formed. एक कप होता है neuroectoderm का कप. ठीक है. Now this developing eyeball needs nourishment. Obviously it needs nourishment. So this nourishment will be given by a artery. And from which part your artery is coming? Let me tell you guys, please see all of you very carefully. there will be a development of a fissure in the neuroectoderm, और इस फिशर का क्या नाम रखा है हमने, हाइलॉइड फिशर. सो क्या हुआ, एक छेद बना न्यूरोएक्टोडर्म में, फिशर बना, और उस फिशर के थ्रू क्या चली गई, उस फिशर के थ्रू एक आर्टरी चली गई, और इस आर्टरी का क्या नाम रखा, हाइलॉइड आर्टरी. So it happens in all of us. We all have a fissure in the neuroectoderm, the hyaloid fissure, through which enters the hyaloid artery and it gives nourishment to the developing eye. This happens with all of us. Now, normally this fissure closes. नॉर्मली क्या होता है बच्चे, ये फिशर जो है ये बंद हो जाता है. कब बंद होता है, एट अराउंड 7th वीक ऑफ जेस्टेशन. So this fissure will close at around 7th week of gestation. But suppose if this fissure does not close, what will happen? अगर ये fissure बंद ही नहीं हुआ तो क्या होगा? There will be development of a congenital anomaly, and this congenital anomaly will be called as, anyone? क्या बोलेंगे इस congenital anomaly को? We will call this as the coloboma of the iris. Now let me show you here. Please सभी लोग बच्चे देख लीजिए इसको. Can you all appreciate that this is the coloboma in the iris? Can you all see? कुछ अलग सा iris नहीं है, कुछ अलग सा pupil. तो क्या अलग है इसके अंदर? क्या अलग है? That iris has a fissure. What is this fissure? We call it coloboma. What exactly is this? Please write down all of you. This is the persistent hyaloid fissure. तो पूछते हैं आपसे, ये कोलोबोमा क्यों बनता है? कोलोबोमा क्यों बनता है कि अगर कभी फिशर क्लोज नहीं हुआ. द हाइलॉइड फिशर इज परसिस्टेंट. एम आई क्लियर फ्रेंड्स? persistent hyaloid fissure. So they can ask you now a picture question. आपको ये पिक्चर दे देंगे, पूछेंगे what is this? This is the coloboma of the iris. Why coloboma has developed? Because the hyaloid fissure is persistent. It is not closed. Clear? Now this coloboma is also called as the keyhole iris. What do you call it? You can also call it a keyhole iris. What can you call it? Keyhole की तरह लग रहा है ना ये, keyhole iris. ठीक है, keyhole iris. Now my next question. This coloboma can be divided into two types. We can say that we have two types of coloboma depending upon the location. Depending upon the location. If the coloboma is like this, if the coloboma is like this, we will call it a typical coloboma. Why typical coloboma? Because the coloboma is infranasal, and infranasal is the most common location. ठीक है? अगर कोलोबोमा कहीं और हुआ, सपोज ऐसे हुआ या फिर ऐसा हुआ, तो हम इसको क्या बोलेंगे बच्चे? एटिपिकल. So you can divide coloboma into two types depending upon the location. If it is infranasal, नाक की तरफ towards the nose, you will call it a typical coloboma. Why typical? Because it is the most common location. ठीक है? तो अगर हम ये पिक्चर देखें बच्चे, तो ये कौन सा कोलोबोमा है? Is it a typical or a atypical coloboma? बताओ. हाँ, this is a typical one. Dr. Apshar, क्या पूछ रहे हैं बेटा आप? I missed. Just give me a second. I'll come back. Yes, all of you absolutely right. This one is a typical coloboma because it is infranasal. I missed somebody asking a question. Huh. So Dr. Sheikh, I am telling you that normally this fissure closes. Normally ये जो fissure होता है बच्चे, ये जो fissure हमने बनाया था ना, so normally this fissure closes in around 7th week of gestation normally. But if this fissure does not close, you will call it a coloboma. Normal closure is at the 7th week. Dr. Iman, it can be both. It can be unilateral. I've seen bilateral cases as well. Dr. Iman, is it okay, beta? It can be both. You can have unilateral, you can have bilateral. ठीक है? चलो, good. So I am sure that you all can identify this picture question. हमें सिर्फ एक ये congenital anomaly पे focus करना है. Okay, I'll ask you questions related to that. So friends, We have just read very basic things. How do you identify eye from front? What are the structures anteriorly? What are the structures posteriorly? How there are the codes? What are the different segments? Few important numbers. We have read about the development and one congenital anomaly. Now, what about the eye of a newborn? एक बच्चा पैदा हो गया है, एक लास्ट स्लाइड, एक मिनट. सो अब की बार एक बच्चा पैदा हो गया है ना, दिस इज अ बेबी was born. So now we will be discussing how that the eye of a newborn is different from my eye, from your eye. That means what is the difference between the eye of a neonate from that the eye of a newborn. Okay, okay, done guys. Dr. Shubham. Yes, Dr. Kavita, what this picture shows is the typical coloboma. Dr. Kavita, जो ये कोलोबोमा है बेटा, ये टिपिकल कोलोबोमा है ना. क्यों? क्योंकि ये इंफ्रोनेजल है, नाक की तरफ है ना ये. ठीक है डॉक्टर नेहरा, डॉक्टर कविता नेहरा. ठीक है, चलो. So again you have to write down something from the table, but first understand also. ठीक है, ये टेबल हमको अच्छे से पढ़ के लर्न भी करना है. So let me just tell you क्या है, देखते हैं, मैं बताती हूँ आपको. ठीक है, please look at me first. Newborn is small, so the eyeball will also be small. So the first thing is the axial length. The axial length of the newborn is small. What is AXL? Axial length. How do you measure this length, guys? From cornea to the optic nerve, how do you measure? How do you measure this axial length of the eyeball? स्केल से करते हो, कैलिपर से करते हो, ऑफ्थाल्मोस्कोप से करते हो, किससे करते हो? We measure the length with the help of ultrasound. Ultrasound का A scan, ठीक है? We have the A scan mode of the ultrasound. Ultrasound A scan is the best, is the easiest method to check the axial length. ठीक है? This is the first thing. So what is the axial length of the newborn? It is just 16.5, which becomes almost 24 in us. ठीक है? तो आपकी लेंथ कितनी आई बॉल की? 24 millimeter. This is the first question. Now understand guys the basics. If my eye size is 24, my vision should be good mostly, and I'm not wearing any glasses. Can you see? But when the eyeball is smaller than 24, there's always a refractive error which will be hypermetropia. छोटी आंख हाइपरमेट्रोपिया, मोटी आंख, बड़ी आंख मायोपिया. ये समझ आता है? So if the newborn's eye is small, what will be the refractive error? It will be a hypermetropia. How much? +2 to +3 diopters. What is D here? D is diopters. ठीक है? What is D here? D is diopters. ठीक है? फिर से नॉर्मल आई 24, नो चश्मा. छोटी आंख हाइपरमेट्रोपिया, बिग आंख myopia. Okay, so everybody of us when we were neonate, we all had a hypermetropia. मुझे भी hypermetropia था, but when my eye grew up to a certain size, my hypermetropia disappeared. Am I clear? ये ठीक है सबको? So hypermetropia. Now what about cornea? So corneal size is smaller, 9 millimeter, which grew up to 11 millimeter in us. ठीक है? Now question क्या पूछते हैं? At which age the 9 millimeter becomes 11? So the cornea of a 2-year-old baby is same as our cornea. ठीक है? This is also a frequently asked question. A 2-year-old baby has the same size of cornea as mine or as yours. ठीक है बच्चे? Now you have to learn as of now that lens is spherical in a neonate with small 2 zones. In us, it has got biconvex shape with 4 zones of nucleus. As of now, you have to learn. After a few minutes, I'll tell you what this is. ठीक है? You have to learn. Pupil is smaller, anterior chamber is shallow. Obviously, because the eyeball is small, the structures will be small. Pupil is also small, anterior chamber, which should be like this much depth, it is now shallow. Okay? Orbits are more divergent, more divergent. More divergent मतलब देखिए मेरी तरफ देखिए. So in us, suppose the orbits are like this. In children, orbits are more widely spaced, more widely spaced. ठीक है? Orbits are more widely spaced, more divergent. ठीक है? You can just write down orbits are more divergent. Orbits are more divergent. ठीक है? Macula is not differentiated. Lacrimal gland is not functional. That is why there is no tear production in a neonate. बच्चा पैदा होते ही रोता तो बहुत है बट टीयर प्रोड्यूस नहीं करता. ठीक है? Why? Because lacrimal gland is not functional, not fully functional. Okay, not fully functional. Next is about fixation. ये fixation का मतलब क्या होता है? You know the wandering fixation. Look at me, friends. Look at me. So I'm able to fixate at a particular object, but neonates are not able to fixate at a particular object. They have a wandering kind of fixation. Okay. And visual acuity is generally poor. It is less than 6 by 60, not very good. ठीक है? Now what about this? कौन सी एज पे विजन 6/6 होती है? So guys, this is a controversial question. Few books mention it to be at the age of 4 years. Few books mention it to be at the age of 6 years. ठीक है? But I would say, हाँ, fixation I'll tell you again. But I would say it is mainly 4 years. ठीक है? I would say it is mainly 4 years when the visual acuity becomes 6/6. Dr. Shubham, I'm telling you, see, look at me, बच्चे. I am and you are able to fixate at a particular object. See, मैं fixate कर पा रही हूँ ना एक object पे, but बच्चों में क्या होता है? Neonates, they are not able to fixate. They have a wandering kind of fixation, like they are not able to put gaze on one particular object. They'll keep on moving their eyes. ठीक है? They'll keep on moving their eyes. See, macula is a part of the retina which is important for the central vision. So in neonates, the vision is not very good. Why? Because the macula is not properly differentiated. Okay. So that is why the newborns do not have a very good visual acuity. Okay. So there are so many questions. And in year 2018 and 19, you had questions related to this hypermetropia. They had given you questions from this topic. ठीक है? ये क्वेश्चन पूछ चुके हैं आपसे. Near objects they can still focus, but distant vision is not very good. See, distant vision is not very good. है ना? 6/60 is about the distant vision. Their accommodation is very strong. See, also they can focus for near objects, okay, but not the distant ones. See, visual acuity is not very good. This is the distant visual acuity. Visual acuity is poor. 6/60 or 6/6 क्या होता है? ये हम आपको last day बताएंगे. How to check the vision? What do you mean by 6/6? What do you mean by 6/60? As of now, please remember that somebody has a good vision. That means 6/6. A poor vision will be a vision less than 6/6. So newborns have a pretty bad vision. ठीक है? Not a good vision. 4. I'm telling you, Dr. Rahul, it's a little gray area. It's a controversial question. Few books say it is 6. Few books says it is 4. Hypermetropia is not able to see clearly. Yeah, it is not able to see clearly the near objects. Yes. See, neonates do not have a good vision, but they still can focus for near. Though they have a hypermetropia as a refractive error, but they can still focus for near. Okay, the distant vision is not good. ठीक है? Though the visual acuity is not good in newborns, nor the near vision, neither the distant vision, both of them are not good. But still, I'm saying that they are able to accommodate. They have a better accommodation than us. Okay? ठीक है? कुछ मुश्किल नहीं है बच्चे. Okay? Chalo, so this was something about the first introduction. I hope you've understood few things. Chalo, मैं कुछ questions पूछती हूँ आपसे. Quick answers here. All of you, quick answers. Good. Everyone correct. So the correct answer is this. सबको आता है ये तो very good. चलो ये बताओ. So read the question first, guys. Guys, I want you to read the question first. ठीक है, आप सब पहले क्वेश्चन पढ़ के फिर आप आंसर दो। हाँ जी, हाँ जी, all of you are correct. So guys, because I've given you a picture question, I'm sure you can see here we have a keyhole iris, and this is because of the incomplete closure of the hyaloid fissure. ठीक है, what can be the problem to the child? He can have the problem of glare. ठीक है, good, good. A simple one here, typical. Mydriasis is due to what? Dr. Sahu, नहीं बच्चे, ओपी पॉइजनिंग्स में तो पक्के से ही मियोसिस होता है. दिस इज द करेक्ट आंसर, थर्ड नर्व पॉलिसी. ठीक है. A similar question was there in your exams last year, 2019, sorry. So condition in which this don't be sorry. All of you, very good. What do you call this? Heterochromia iridium, है ना? Horner syndrome, heterochromia iridium. Very good. ये बताइए, the muscles of iris are derived from. Good. Neuroectoderm is the correct answer. Very good, very good, very good, very good. Good, good, good. It's a very interesting question. All of you try to answer. All of these are fully achieved by 6 months of age, except. It's a very interesting question. Yes, very nice, very good. Corneal size, because we have read that the corneal size is fully achieved by 2 years of age. Yes or no? Yes or no? Rest everything gets fully achieved by 6 months of age, though they are not present at birth, but fully achieved by 6 months. ठीक है. जिसने भी आंसर गलत बताया है बच्चे, मैक्यूला हो जाता है 4 to 6 months में, है ना? Please remember. Okay, it is a very interesting question, I told you. So this was the question there in your exam in 2019 already. Refractive condition at birth is what? Now the answer here is A. Very good. ठीक है ना, सिंपल है ना. रिफ्रैक्टिव कंडीशन एट बर्थ, दिस इज ए. गुड गुड गुड, बहुत बढ़िया. चलो ये बताओ, समथिंग ट्रिकी हियर, समथिंग ट्रिकी. All of you read all the options. Great, great. All of you are correct again. So B is the correct answer. It produces an increased curvature of the anterior surface of the lens. ठीक है? It is not increased by cycloplegic drug. It is dependent on the elasticity of the lens, and zonules are not stretched. Rather, the zonules will be relaxed. ठीक है ना? Good. बढ़िया आ गया है आप लोगों को, है ना? Zonules are relaxed. You also want to get relaxed? We still have the time for a break. So what about ultrasound A scan? So it measures the axial length. It measures the axial length. Okay, what about B scan? So please, you can guys also write down. Ultrasound for the eye have two modalities, two modes. First is the A scan mode, the second is the B scan mode. So A scan mode is for the axial length, the B scan mode is for what? It is to check the posterior segment. Please remember. बच्चे, ऐसे बहुत सारी पैथोलॉजीज होती हैं जहाँ पे फॉर द पोस्टीरियर सेगमेंट you can't see from your ophthalmoscope. So where you cannot see with your ophthalmoscope, you must do an ultrasound. Which ultrasound? The B scan mode. So B scan mode is to check for the posterior segment. So this is the B scan mode. This is for the B scan mode. This is also for the B scan mode. ठीक है, ये सारे ही काम हम B scan से कर सकते हैं. All right, friends. Now is that clear? So A scan is for axial length. B scan is to check for the posterior segment problems. Okay? Chalo, good. ये बताइए, a simple one, a very interesting one also. हाँ जी. So this is a complete question. All are true about the eye of a neonate except. Except. Please see the word except here. They are born with a hypermetropia. They have a shallow anterior chamber. They have a high accommodation, but fusion is not fully developed at birth. Fusion is completed, you have read, by around 2 to 3 months of birth. So it's not the fusion which is completely developed at birth. Am I clear? ठीक है बच्चे? What is this AC here? They have the shallow anterior chamber. ठीक है, shallow anterior chamber. We have just discussed that newborns have a very high accommodation. See, my accommodation is poorer than you or weaker than or better than you. My accommodation poorer or better than you. I'm old. Arey, no, no, not same. So when we grow old, I'm elder to you, so my accommodation should be poor. Okay, my parents have a poorer accommodation than me. Grandparents further decrease in accommodation. Okay, please remember. So neonates have the strongest accommodation. As we grow old, the accommodation declines with age. Okay, Dr. Teresa, yes. See, बच्चे देखो मैं बताती हूँ. Dr. Teresa has a doubt about the corneal size. See, beta, the size of the cornea is measured like that. है ना? So newborns have 9 millimeter of the diameter of the cornea, and we have the diameter of about 11 millimeters, and this size increase completes by 2 years. After 2 years, there's no further growth of the size of the cornea. Now is it clear, Dr. Teresa? Okay? ठीक है? Dr. Aditya, is this the question you are interested in? Dr. Aditya, यही पूछ रहा है बच्चे. लिखना है, लिख लो. ठीक है, तो अभी हम थोड़ा सा लेंस शुरू करते हैं. वी आर डन विद वन टॉपिक, टॉपिक नंबर 1. एनी डाउट यू कैन फ्रीली आस्क मी. ठीक है, कुछ भी पूछना है. सी फ्यूजन रिफ्लेक्स ना मैं स्क्विंट में बहुत अच्छे से समझाऊंगी. फिर भी डॉक्टर ऐश्वर्या, see, fusion will read again when we talk about squint and binocularity, but I'll just give you a brief idea. So I have two eye, I have a binocular vision, isn't it? So if I see a object, one image is formed at the retina here, another image is formed at this retina, isn't it? So the capacity or the ability of two eye to fix this image into one, this is called as fusion. ठीक है बेटा? Okay, Dr. Ishwarya, the ability of eye to fuse the two images formed by the different retina is called as the fusion, which is not so great when we were neonate. ठीक है? Neonate का fusion अभी लिखा है ना हमने at around 2 to 3 months, not at birth, but it starts developing at around 2 weeks. It gets completed by almost, देखो, binocularity at around 3 months लिखा है ना, देखो. ठीक है? So fusion is completed by 2 to 3 months. Fusion is completed by almost 2 to 3 months. ठीक है? It starts developing at around 2 weeks after birth, and it is completed by almost 2 to 3 months. ठीक है डॉक्टर पलक? क्लियर है? ठीक है, चलो अब नेक्स्ट टॉपिक शुरू करते हैं और फिर हम एक बीच में ब्रेक ले लेंगे. we'll take a break in between. Let us start with lens and cataract because it's again a huge topic, so definitely we would want a break in between. So let us start with it so that we in continuity will finish before the lunch time. Now friends, this is the shape of the lens and this is the detailed anatomy of lens. तो आप मुझे पहले बताओ, what is the color of this lens? What is the color? What do you think is the color of the lens? Anyone? Very good. It is a transparent structure. So what about the blood vessels? How the lens gets nourished? What about the blood vessels? What about the vascularity? Hanji, anyone? What about the vascularity of lens? Lens is also a avascular structure. And what is the shape of the lens, guys? What is the shape? So lens is a avascular structure. Lens is also a biconvex structure, isn't it? It is a avascular. biconvex structure, है ना, which has no vessels. So you have to tell me, if the lens has no blood vessels, how is it going to get its nourishment? लेंस को nourishment कहाँ से मिल रही है जब blood vessels ही नहीं है? बच्चे, this is the first slide which I am writing. Very good. All of you are absolutely correct. So, lens has no blood vessels. The source of nourishment to the lens is mainly the aqueous humor. Okay? But definitely, vitreous humor also contributes. Okay? The most important source of nourishment to the lens is by the aqueous humor. सही बता रही हूँ? Vitreous humor भी तो है ना लेंस के पीछे. This also contributes but very little. So if they ask you one, you have to say it is the aqueous humor. ठीक है? This is the most important source of nourishment. Question number 1. Now, what about the respiratory coefficient? हाँ जी, respiratory coefficient क्या होता है? What do you understand by the term respiratory coefficient, guys? It is the amount of carbon dioxide released upon oxygen utilized. So for our lens it is 1. ठीक है, फिजियोलॉजी का क्वेश्चन है, रेस्पिरेटरी कोफिशिएंट, amount of carbon dioxide released by amount of oxygen utilized, it is 1 for the lens. ठीक है, सिंपल छोटे छोटे क्वेश्चन है, something from the physiology. Now what about the total refractive power of the eyeball? अच्छा, पहले मुझे देखो, to understand something, look at me to understand, guys. What is the main job of the eye? The main job is refraction, image formation. तो ये image कैसे बनती है? Suppose I want to look at the pen. What will happen? Light rays from the pen comes to my eye, strike the cornea, aqueous humor, lens, vitreous humor. Finally, the light rays goes to retina and then the image. बेटे, दिस वाज द फर्स्ट स्लाइड विच आई रोट. दिस वन, डॉक्टर त्रिपाठी, यहीं से शुरू किया बच्चे हमने. दिस वाज द फर्स्ट स्लाइड. ओके, यू कैन राइट डाउन. हाँ जी. Meanwhile, all of you understand. So whatever names I have said, cornea, aqueous humor, the lens, aqueous humor again, the vitreous humor, and finally the retina. All these areas are refractile areas. That means refraction will happen. So light rays will go through it and then the refraction will occur. So the total power of the eyeball is around plus 60 diopters. ठीक है, हम पावर को डायोप्टर्स में लिखते हैं. सो प्लस 60 डायोप्टर्स इज द टोटल पावर ऑफ द आई बॉल. दिस कैपेसिटी ऑफ द आई बॉल to refract light rays is plus 60. Now from that plus 60 plus 43 is mainly contributed at the cornea. So major refractile surface will be cornea. Maximum refraction occurs at the cornea. बाकी का कहाँ होता है बच्चे? अप्रोक्सीमेटली प्लस 17 इज बाय द लेंस. ठीक है, ईच एंड एवरीथिंग इज अ क्वेश्चन. यस डॉक्टर सुदीप, एब्सोल्युटली करेक्ट. Now all those surfaces which I have named also should have a refractive index. Yes or no? If I think that refractive index of air is 1, all these surfaces they also have some refractive index. So next is we should write down what are the refractive index of each of these. ठीक है ना? अब हम लिखते हैं ये refractive index क्या होते हैं. So very simple to remember, guys. Aqueous and vitreous are the liquids, so their refractive index is less, 1.34. What about the cornea? Cornea का थोड़ा ज़्यादा है, 1.37. फिर आता है लेंस 1.39. फिर आता है सेंटर ऑफ द लेंस, which is 1.42. Okay, Dr. Sunil, is that okay? This is what you want to write or further? Okay, I hope this topic is clear. So please understand, the center of the lens has a higher refractive index as compared to the periphery. Center of the lens is supposed to be more sclerosed. ठीक है, ज़्यादा sclerosed है वो. All right, guys. Each and every word is a question here. Each and every word. चलो आगे चले. हाँ. So next question is, what about the metabolism of the lens? Is it mainly aerobic or anaerobic? The most important metabolism in lens is anaerobic. Anaerobic, ठीक है. दो एरोबिक भी होती है बट ज्यादातर क्या होता है, एनारोबिक मेटाबॉलिज्म होती है लेंस में. मोस्ट इंपॉर्टेंट इज द एनारोबिक. नाउ व्हाट अबाउट द वाटर कंटेंट इन आई? एनीवन? Water content in the lens? Anyone? How much is the water content in the lens? It is approximately 65%. Yes. And the rest is the lens proteins. The lens proteins कितने हुए? Approximately 35. है ना? Approximately these are 35. Now here comes the question. Here comes the question. Lens proteins are mainly of two types. First is the water soluble proteins. अनदर वन इज द वाटर इनसॉल्युबल प्रोटीन्स. ठीक है जी. वाटर सोल्यूबल होते हैं या फिर वाटर इनसॉल्युबल होते हैं. तो मेरे में क्या है ज्यादा, आप में कौन से है ज्यादा, वाटर सोल्यूबल या वाटर इनसॉल्युबल? हम सब में अभी तक ज्यादा क्या है, क्रिस्टलिन्स विच आर द वाटर सोल्यूबल प्रोटीन्स. Mostly we have water soluble proteins, but what will happen when we grow old? When we grow old, our water soluble proteins will be converted towards more water insoluble proteins. Is it clear, friends? What will happen when we grow old? The water soluble crystallines, yes, this process is called as cataractogenesis. मैं बता रही हूँ डॉक्टर साहू again. समझो मेरी बात बेटा. So I am saying that all of us have two types of proteins in the lens. कुछ water soluble होते हैं, कुछ water insoluble होते हैं. ठीक है. Majorly they are water solubles, but when we grow old, we have degenerative changes. One degenerative change is a cataract. What is a cataract? Loss of transparency. So during this process, what is happening? The water solubles will be mainly converted into water insoluble ones. ये समझ में आया? Now is it okay, Dr. Sahu and rest of the people? ठीक है? So if I talk about my grandparents, what will they have more? Suppose somebody who's 75. Yes, Dr. Sahu, they have more of insoluble. ठीक है? If I talk about a 14-year-old boy, he will have more crystallines. ठीक है बच्चे? This is the age-related change. Water solubles will be converted more towards the insoluble. Senility, बूढ़ा हो जाना बेटा. Age, growing age. Yes, this is how a senile cataract develops. Okay? डॉक्टर कविता, बूढ़ा हो जाना बच्चे, एजिंग. ठीक है. सो ये माइक्रोस्कोपिक चेंज होता है हमारा. ठीक है. चलो आगे चले. So this was briefly about the physio. हाँ, this one more thing. So guys, you know antioxidants है ना, आजकल antioxidants का कितना रोल है, because we all have a lot of stress. So you see people aging early. They have more of gray hair, more of stress related change. So there's a role of antioxidants here as well. ठीक है. They are protective for cataract formation. So what are those antioxidants which play a role in the lens? Please write down. This is a list here. Antioxidant mechanisms. Very good, Dr. Imad. One of them is vitamin C. Anything else, bache? Very good. One of them is vitamin C. Anything else? Vitamin E. Please remember, Dr. Imad, vitamin A is not in the list. Please remember. ठीक है बेटा? Vitamin A is not in the list. ये हमेशा याद रखना. मम्मी तो कहती है विटामिन ए खाओ. मम्मी गलत कहती है. हाँ जी. मम्मी गलत कहती है विटामिन ए खाओ. विटामिन ए का तो कोई रोल ही नहीं है. So mothers are always right. Though vitamin A does not play a role for lens, but it definitely play a role in retina for the proper functioning of the rods. ठीक है? ठीक है? Yes. For the proper functioning of rods. So if vitamin A is not adequate, you may have night blindness. Okay? चलो. Next is catalase. These are certain enzymes. Another one is peroxidase enzyme. Yes, even white hot spot. Good. मम्मी की चप्पल में भी विटामिन है. Peroxidase. Next is superoxide dismutase. Superoxide dismutase. And the next one is glutathione. Glutathione. So please mug up this list, and the best one amongst the list is glutathione. This is the most important one. Okay? This is the most important one. So this is a sum up list. This is your summed up list. ठीक है? चलो आगे देखेंगे बेटा. ये थोड़ा सा मुश्किल है, but let us try to understand. Let us try to understand in detail about the anatomy of lens. Okay, let me first explain you and then we'll write down something. We'll write down something first. Let me just explain you few facts. चलो इसको देखिए बच्चे, इस पिक्चर को. All of you have a look here. No need to write down till the time I write and I let you know. ठीक है, देखिए सब लोग. So lens has got 4 layers. The first layer is the layer of capsule. ठीक है, सबसे बाहर क्या है बच्चे? एक कैप्सूल. कैप्सूल आप देख रहे हो कि यहाँ पे कैप्सूल सबसे थिन है. Can you all see? This is the part where the capsule is very very thin, and this part is called as the pole. Which pole? The posterior pole. This part is called as the anterior pole. Look at me everyone. If this is your lens, this part will be your anterior pole. This part will be your posterior pole, the central most prominent part of the anterior and the posterior surface respectively. ठीक है, तो क्वेश्चन क्या है? Capsule is thinnest at the posterior pole. Okay, next. After capsule, we have a layer of epithelium. What do we have? Epithelium. But mind you, please see carefully. The epithelium is not there in the posterior part. Can you see any epithelium here? No. Epithelium posterior part में है ही नहीं. ठीक है? Next. Inside the epithelium, we have the cortex. So this is all your cortex. This is all your cortex. Now inside the cortex we have the nucleus. So guys, all of you appreciate, please see that this is your nucleus. Please all of you appreciate. Nucleus has 4 zones. If you start from the center, you have embryonic zone, then you have this fetal zone, the next is the infantile zone, the next one is the adult zone. Can all of you appreciate the structure of the lens? All of you appreciate it? सबको समझ में आ गया? फिर से कैप्सूल, एपिथेलियम, कॉर्टेक्स, न्यूक्लियस. न्यूक्लियस के अंदर भी 4 zones हैं. Now let's go back to the time of gestation and see. Let's go back to the time of gestation. Now guys, when the lens starts developing, it is not biconvex in shape. होता क्या है बेटा? Lens spherical होता है. Lens is not this. Look at me. It is not this. Lens is like a gola, sphere. ठीक है? अब क्या होगा देखेंगे. So lens which was spherical, it has both anterior and posterior epithelium. But the posterior epithelium was used up. It was used up. The cells elongated and they were used up in formation. Okay. So lens के जो posterior epithelium के fibers थे, they elongated and they are now used up. That is why we don't have posterior epithelium now. ठीक है? अब वो use up होके क्या बना उससे? So it formed the central most part of the lens. Please all of you see, when we were neonate, we had anterior and posterior epithelium both. But gradually what happened? The posterior epithelial cells were used up because they formed the central most part of the nucleus. And this part of the nucleus is called as the embryonic, the central most part of the nucleus. ये समझ में आता है? यहाँ तक समझ में आया है? So let us write down something and then things will become more clear. ठीक है? So please लिखिए. सबसे पहले है बाहर capsule. Capsule has mainly the type 4 collagen. This is the predominant collagen. It is a very thin structure. and you should know that this is thinnest at the posterior pole. How much is the thickness? This is approximately 4 microns. Okay, question. How much is the thickness? It is only 4 microns thick. Okay? Now is the highlighter okay? ठीक है बेटा? Okay, so there are three questions. Which predominant collagen is there? Type 4. Where is the capsule thinness and what is the thickness? There are three questions. आगे चलते हैं. Now what about inside of the capsule? So I told you we have the layer of epithelium, but in epithelium we only have anterior. Why? Because posterior epithelium is used up. ठीक है? It is used up, so it is absent in adults. ठीक है बच्चे? We only have now the anterior epithelium. Now what is the third layer? Inside the epithelium we have cortex, and inside cortex what do we have? This is the nucleus. So now here comes a little tricky thing. आप पहले लिख लो फिर मैं समझाऊंगी. First you can write down and then I'll explain. So as of now, we know from the diagram that we have 4 zones of nucleus. Now how the zones are developed, that is something tricky, but try to understand. देखिए, so this was at the time of gestation, at around 3rd week of gestation. So this posterior epithelial cells elongated and they are used up. Used up in formation of what? It is used up in formation of the primary lens fibers, and we call it the embryonic nucleus. ठीक है, हमने क्या नाम दिया? Embryonic nucleus, embryonic zone. ठीक है, अब ये जो काम हो रहा था ये कब हो रहा था? ये हो रहा था 0 to 3 months of gestation में. This was all happening in only 0 to 3rd month of gestation. Are you able to understand? So all those fibers which were formed till 3 months of gestation, we call it embryonic zone. ठीक है? Guys, you will be surprised to know that lens is the only structure which continues to grow throughout the life. Not in the length but in the width. ये जो लेंस है मेरा, ये अभी भी ग्रो कर रहा है धीरे धीरे. आपका लेंस ग्रो कर रहा है. ठीक है, कैसे ग्रो कर रहा है? Because it is increasing in the width. So what is the source of the new fibers? New fibers are being added upon, but from where they are coming? They are coming from the anterior fibers, anterior epithelium now. ठीक है, अब ये anterior epithelium में कुछ cells हैं. हाँ हाँ, see, embryonic nucleus is from the posterior epithelium. ठीक है, the rest of the fibers which are coming after the 3 months are coming from the anterior epithelium. Okay, so after 3 months what will happen? Please see all of you. So from 0 to 3rd month, we say it is embryonic nucleus. From 0 to 3 months. After 3 months, what will happen, guys? So this zone will be the infantile zone. This zone will be the fetal zone. Okay? In which month this is happening? This is from 3 months till birth. So all those fibers which were formed after 3 months till birth, it will be called as the fetal zone. ठीक है, क्या नाम दे दिया हमने? fetal zone का. Now what next? Afterwards, whatever fibers are being formed after birth, उसका क्या नाम दे दिया हमने? infantile zone. So infantile zone is from birth till puberty, and after puberty whatever fibers are being formed. अब जो फाइबर्स बन रहे हैं आफ्टर प्यूबर्टी, व्हाट डू वी कॉल देम गाइस? वी कॉल देम द एडल्ट जोन. ठीक है, सो डिपेंडिंग अपॉन द टाइम पीरियड वी हैव नेम्ड द डिफरेंट जोन्स ऑफ न्यूक्लियस डिफरेंटली. सबसे पहले क्या बनी? एम्ब्रियोनिक, फिर क्या बनी fetal, फिर क्या बनी infantile, and nowadays whatever fibers are being formed they are accumulating in your adult zone and cortex. Okay, ये सबको क्लियर होता है? All of you? Any problem बचे? सबको क्लियर? चलो, I'll ask you few questions. Now you tell me how many zones of nucleus do you have? We have 4. What about the newborn? Newborn will have only 2. Which 2? Dr. Kajal, not 2. You have 4 zones, beta. Newborn has 2. Which 2? Newborn में कितनी है? कौन सी है? Embryonic and fetal. Very good. Newborns have 2 embryonic and fetal. सबको क्लियर है ना ये चीज अब? Good. Very good. Good. 0 to 3 months, beta. 0 to 3 months. This is months. Okay? हाँ. Okay, Dr. Shreya, you think I'm going fast? Guys, is my speed okay? Is my speed all right? Newborns won't have infantile. Infantile नहीं होएगा ना? Fetal तक ही बना है ना बेटा? Fetal तक ही बना है ना? It starts from the embryonic, then the fetal. After birth, will have infantile. Infantile will continue till puberty. ठीक है? Till puberty, we will have 3. Yeah. ठीक है? चलो. I hope you have written. मैं आपसे अब कुछ क्वेश्चन पूछ लूँ एक. देखें आपको आएगा कि नहीं आएगा, है ना? I'll ask you a question. All of you confidently try to answer. All of you try to answer. What is true about the lens? Oi hoy, beta, what is true? What is true? This is not true. What are soluble proteins are crystallines? This is true and this is also true. Both of them are true. What ectodermal? This is surface ectodermal. ठीक है? This is surface ectodermal. So both B and D are correct. ठीक है? See, Dr. Madhvi, you are not alone. I just want to say it's not you that you are alone and who has read the incorrect question. It's mainly uh, we sometimes get hurried up and we lose marks, and then later on we realize that we have actually lost many marks. We do not read the question properly, है ना? ये आपके साथ ही नहीं, ये सबके साथ होता है. सबके साथ होता है ना? ऐसे नहीं करना है. It's not a competition issue, it's there in your mind. हम वही लिखना चाहते हैं, वही करना चाहते हैं जो हमारा दिमाग चाहता है, जो हमारा दिल चाहता है करना, हम वही देखते हैं. The line which we saw is the answer. We have forgotten to see about except the word true or the word false. ऐसे नहीं करना है ना? Respiratory coefficient is 1. It is 1. तो ऐसे नहीं करना है आपको, पेशेंटली यही तो आपको कोशिश करनी है. सो दिस इज, हाँ, सिली मिस्टेक्स नहीं करनी है बच्चे. आप देखोगे ना, सिली मिस्टेक्स में आपके 5 से 7 नंबर्स चले जाते हैं. आप कम से कम 7-8 सवाल गलत कर देते हो सिली मिस्टेक से. यू नो द टॉपिक, यू नो एवरीथिंग वेल, बट समटाइम्स आप जल्दी में होते हो या आप ढंग से नहीं पढ़ रहे, कुछ भी करके हमारे बहुत सारे मार्क्स गलत हो जाते हैं. तो ऐसे तो बिल्कुल नहीं करना है. वो 5-6 मार्क्स ही बाद में याद आते हैं. 145 पे रह गए, 148 पे रह गए, है ना? ऐसे होता है ना? तो ये नहीं होना चाहिए इस बार. Patiently, you have ample of time. Read the question well, see the question well, read all the options. मैं कहती हूँ आपको हर क्वेश्चन में पूरे आंसर्स नहीं बताऊंगी, आपको सारी ऑप्शंस नहीं बताऊंगी, बट वो जो आंसर है वो आपको पता होगा अगर आपने टॉपिक पढ़ा है ना? So focus on what you know actually, believe in your concepts, but read the question well. क्वेश्चन पढ़ने में टाइम लगाना है, ठीक है? चलो. So guys, look at this everyone, a very simple thing. When we are young, our lens is transparent. So this pupillary reflex is black. Why it is black? Because the lens is transparent, so light rays are going inside without any obstruction. But what happens when we grow old? The lens is clouded. Lens loses its transparency and becomes cataractous. So what will happen? The pupillary reflex appears white or gray. प्यूपिल इज नॉट अ स्ट्रक्चर, मैं अभी भी कह रही हूँ प्यूपिल तो छेद है, प्यूपिल तो होल है, छेद है. तो अगर आपके प्यूपिल के पीछे परेशानी है, द प्यूपिलरी रिफ्लेक्स appears to be grayish white. Okay, this is how we see a cataract by a grayish white pupillary reflex. Now you are going to tell me what is the most common etiology of cataract. Hanji, what is the most common etiology of cataract? Anybody? What is the most common cause of cataract? कौन बताएगा मुझे? Yes. So now we are talking about the causes of cataract, and the most important causes of cataract is the age, advancing age. Anything else, guys, apart from age? Next is the sunlight. Sunlight का which spectrum? Especially the UVB spectrum. Especially the UVB spectrum. ठीक है, UVB spectrum. UVB spectrum, sun damage. So what should you suggest your parents and grandparents that they should wear? They should wear shades. जो वो कभी पहनेंगे नहीं, है ना? नहीं पहनते ना? Next is stress. Next is yes, you can have congenital infections also, like torch infections to the pregnant female. Then the baby will have congenital cataract. Absolutely, Dr. Sudeep. ठीक है, mother, if the mother catches torch infections, then definitely the baby, the newborn, can have a congenital cataract. Next one is syndromes. Some syndromes are associated with cataract. This is a very, very important question, guys. Let us write this down. So the first syndrome which is associated with cataract is your Alport syndrome. Alport syndrome. Now Alport syndrome is also having one more congenital anomaly. So please see everyone, देखिए, normally lens is like that, but in Alport syndrome, the interior surface of lens becomes more conical, and this particular congenital anomaly is called as anterior lenticonus. ठीक है, लेंटी मतलब क्या बच्चे? लेंटी मीन्स लेंस, कोनस मीन्स कॉनिकल, तो क्या बना? लेंटिकोनस. योर lens has become conical in its anterior surface. ठीक है, in which syndrome do you see that? So it is seen in your Alport syndrome. A and A is what you have to learn. ठीक है, A and A is what you have to learn. Alport syndrome, anterior lenticonus. This is the mnemonic. Lenticonus. Lenti means मतलब lens. Conus means conical. ठीक है बेटा, सो लेंस आपका कॉनिकल हो गया, कहाँ से? एंटीरियर सरफेस से. सो मैं बताना चाह रही हूँ कि एल्पोर्ट सिंड्रोम में एक तो कैटरेक्ट हो सकता है, और क्या हो सकता है? एंटीरियर लेंटिकोनस. नाउ इज इट क्लियर? डॉक्टर सिद्दीकी, क्लियर है बेटा? क्लियर है डॉक्टर सिद्दीकी? आप रुखसार, डॉक्टर रुखसार, ठीक है बच्चे, चलो. Now after Alport syndrome, the next one is Loeys syndrome. Loeys. Loeys syndrome में इसका उल्टा है. What do we have here? We have a posterior lenticonus. Lenticonus तो है, but it is in the posterior part of the lens. Posterior lenticonus. ठीक है? What do you call it? Posterior lenticonus. Okay? What about the third one? The third syndrome which is associated with cataract is Down syndrome. And Down syndrome has something very special in the iris. We call it brush field spots. Important question. Brush field spots in the iris. ठीक है, brush field spots in the iris. Please remember these three syndromes which are associated with cataract. Okay. So what is the next cause? I think we are on fifth hunting. The next one is very very important for you, smoking, है ना बच्चे? So आप लोग तो बड़े prone हो smoking, stress, though you are not old enough to have cataract, but definitely it can cause a early cataract. ठीक है? Early cataracts. So please remember, no stress, no smoking. ठीक है? चलो. Now, apart from that, you can have certain disorders like diabetes, metabolic disorder. ठीक है? There can be some metabolic disorders. There can be some metabolic disorders. Okay? Now, guys, let's see a very, very important basic thing. Something about the classification of cataract. Something about the classification of cataract. All of you have a look. Yes, you can have drugs also like steroids. Some drugs induce cataract. Some drugs. बहुत सारी चीज़ें रेडिएशनल है, मेटाबॉलिक डिसऑर्डर्स हैं, देर आर सम ऑक्यूपेशनल हैजार्ड्स. वी विल रीड ऑल ऑफ देम. ओके, drugs like steroids, as Dr. Imad has told us. Now what about the classification of the cataract? So I want all of you to look here. I want all of you should look here. पहले देखिए इधर सभी लोग. So guys, if you have a opacification of the capsule, you will call it a capsular cataract. Suppose the opacification is in the subcapsular region, subcapsular, you will call it a subcapsular cataract. Suppose the opacification is in the cortex, you will call it a cortical cataract. Suppose the opacity is only in the nucleus, you will call it a nuclear cataract. And suppose if it is in the pole, only in the pole, you will call it a polar cataract. समझ आ रहा है? जहां पे ओपेसिटी होती है आप उसको वो ही नाम दे देते हो. व्हाट इज ए एंड बी? एंटीरियर एंड पोस्टीरियर. एंटीरियर कैप्सूलर, पोस्टीरियर कैप्सूलर, एंटीरियर सब कैप्सूलर, पोस्टीरियर सब कैप्सूलर, cortex, nucleus and polar cataracts. Okay, so depending upon which place has the opacification, we can classify the cataract accordingly. Is this part clear, bacha? Is this part clear to all of you? Fifth is polar. Fifth is polar. The opacity is at the pole. So this slide has two questions. Let us write down one by one. This slide has two questions. Okay? I'll explain you and then you can write. So wherever you have opacity, you can classify cataract accordingly. ठीक है? जहां आपको opacity दिखेगी, वहीं पे आप उसका नाम दे दोगे. Okay, friends? चलो अब देखिए क्वेश्चन नंबर वन. क्वेश्चन नंबर वन सेज दैट posterior subcapsular cataract is visually most disturbing. Visually most disturbing का मतलब क्या हुआ? ठीक है, this is our question number one. This is our question number one. Now, visually most disturbing means what? Look at me, all of you. Look at me. Suppose there is a patient who has a total cataract in one eye. Total cataract means he can't see anything. Suppose the vision is very poor, but at least there's no pain, there's no or any other disturbance here. But suppose one eye has a cataract which is a very small posterior subcapsular cataract. So if he has such type of cataract, the problem with him will be, see all of you, the problem will, will be that of glare. What do you understand by the word glare? चौंध पड़ना. जैसे ही आप बाहर जाओगे आपको चौंध पड़ेगी कि आप घर से बाहर नहीं निकल सकते. So this cause more disturbed vision, isn't it? Though you can see, but there's a lot of glare that you can't step out of your house. So why is this phenomenon of glare? Let me explain you. So once you go into sunlight, what will happen to your pupil? Pupil will become small, yes or no? So the iris is this. If this is your iris, the pupil will become smaller further in sunlight. So what would happen? The rays of light which will be coming, the rays of light, अगर ये ray of light है तो ये directly जाके उस opacification पे strike करती है. Rays of light will strike the opacity and then there will be a scattering of light. And because of this scattering of light, the patient will have problem related to glare. Okay? Okay? This phenomenon of glare is the reason why posterior subcapsular cataracts are visually most disturbing. Are you able to understand, friends? Okay? So this is your question number 1. Okay?